Hello, welcome everyone. We are very excited to be coming to you tonight with a spotlight of some of our speakers for our AOS Annual Meeting in Greenville, South Carolina. So tonight we have two speakers with us, Lois Banta and Tia Hunter. And I'm so excited to have both of you here with me. Can I just ask you to, Lois, starting with you, just introduce yourself and tell us a little bit about you and your background.
Well, hello, everyone. My name is Lois Banta, and I am going to be speaking on the practice management topic of my top 10 management tools. So we're going to be covering everything from setting goals to choreographing your schedule to ideal communication skills, treatment planning, morning huddles, team meetings, the works. I'm so excited to be able to present alongside my buddy, Tia Hunter, who you'll be introduced to in a moment. Some of the areas that we're going to be covering in communication is the important link that communication plays in the important role with your systems and protocols. You can have great systems, but if you don't have good communication skills, your systems might falter. You can have great communication skills, but if you don't have good systems and protocols in place, then you're going to have a breakdown there as well. So I'm very, very excited about this topic. It's my absolute favorite topic to present on. It's also going to touch on the beyond the operatory skills, leadership, team building, training, orientation, making sure that you have the right people on the bus and the right butts in the right seats. So I'm very excited and honored to be invited to present this course. Thank you very much.
Thank you. I'm so excited to hear about that, and excited to be there because I think there's going to be a lot of teams there, a lot of doctors, and it's going to really speak to everyone, I believe.
It really does involve everyone.
Yeah. Tia, can you give us a little overview of you, your background, and kind of what you're going to be speaking about?
Absolutely. Well, first of all, thank you for having me. And second of all, if you've never seen Lois Banta, you are in for a treat because she's amazing. But I have been a dental assistant for a very long time, 42 years. And so my presentation is called Rockstar Dental Assistant. Now, this isn't necessarily about being a dental assistant. This is great for any team member to come to. And I do talk about, what it takes to be the best you can be. So whatever that looks like, we're going to talk about all kinds of things for the clinical area. We also talk about leadership and how we become leaders in the clinical area and what that looks like. Communication is just as important in the back as it is in the front. So we've got a lot to discuss. Everything from you name it, we are going to talk about it. We do throw in some OSHA and infection control in there because we want to do it right. If you're going to be a rock star, you've got to do everything correctly. So we've got a whole kit and caboodle of things to talk about in our short presentation, but we're gonna give it a powerful punch.
Yeah, absolutely. Well, I appreciate that. I think it's now in the industry, you see a lot of change and you see a lot of people dealing with challenges with regard to sort of getting new team members onboarded and up to speed or turnover in team. Is there anything that you kind of have, either of you, that you could sort of speak to on that front?
I'm going to guess both of us can speak very, very a long time on that. My 2 cents, it starts with writing the right ad and having the right interviewing process and finding the right perfect fit for your practice, and also involves a little bit of cross trainings to make sure that if there is an each one help one environment in your practice, that you know how to do that part of that person's job so that there's seamless integration. And I love the really fine-tuning and developing relationships between the clinical and the administrative teams. They work really, really well together when they can communicate well together and hand off well together. So that's my 2 cents about that hiring process.
Yeah, what about you, Tia? Do you have any sort of advice on people who are onboarding new team members, sort of especially in the dental assisting area?
Well, Lois hit the nail on the head, and that goes for any team member in our office. And sometimes we're going to have to think outside the box now, and maybe not necessarily hire someone with experience, but hire the right people with the right attitudes and personalities that we can train. And of course, communication is all part of that, because if we're not communicating, we're not getting anywhere. So it's about training them too. Once we have them, what do we do with them? And we have to make sure that we're hitting all those bases. We want to set them up for success. So we've got to be sure that we're training them and giving them everything they need to succeed. And sometimes I think when our team members fail, it's because we haven't prepared them and we haven't helped them get there. So that's something we want to focus on now, is really helping those team members be as successful as they can be, because that's only makes us more successful.
Yeah, absolutely. How would you, just from your observation, kind of how would you say the industry has evolved in the last 3 to 5 years, and what unique things have people faced?
Well, I can tell you how we've evolved, and I can also tell you where we keep getting stuck. So we've evolved in the advancement of all of the technology that's out there to help a dental practice really treat the patients completely. And that goes on the clinical side and the administrative side of the technology, the software that's there, all the tools that are in place, the intraoral cameras, the diagnodents, all of the tools that we utilize in the dental office to properly diagnose and treatment plan patients happens on both sides of the fence, both on the admin and the clinical side. And where we keep getting stuck is, well, I guess I have to go back to, if I were president of a dental school, I would make the undergrad requirement a degree in business. They don't get the business training. They don't get the HR training. They graduate as a dentist, and suddenly, poof, you're a business owner. And that can breed all kinds of frustrations, because they don't necessarily come out already with all of the tools on how to lead and hire and train and implement all the processes necessary to run a successful business.
Yeah.
Again, she's amazing. Listen to her. She's amazing. She hit the nail on the head. And you're absolutely right. They're trained to work on teeth, and they get great training in that, but they don't get great training in anything else. And that's why it's so important that if you can't do it, you need to outsource it to someone who can. And don't be afraid to call in a consultant, or use the technology. Use all the technology that's available at our fingertips that we didn't have 42 years ago when I began. So it's knowing what you need to learn, and it's knowing when to turn that over to someone else that can help you.
100%. And it's never too late. School's never out for the pro, and it's never too late to keep learning, to learn new things and to learn new processes. If we slowed down just a scotch and took the time to get the training ourselves to learn how to be a more effective and productive business owner, as well as hiring the teams, et cetera, you'd be in so much of a better place. And so a lot of what I'm doing in the masterclass training is, and what Tia is doing in her training, is this one-on-one, not focusing, spreading the net far and wide, but really hyper focusing on what's going to help them the best and the fastest and the most efficiently.
I tell dental assistants, I want them to create value in themselves. And one of the ways that they can do that is dentists are overwhelmed. They have a lot to do. They're a business owner. They're trying to put all the pieces together. And I always tell them, find the weak link in your practice and let's make it work. And no matter what that looks like, create value in yourself. Dentists need help. And they really want their team members to come in and help them and bring them services and products and ideas that will help their practice grow. So I like to involve dental assistants and get them engaged in the practice so they can do just that. That's good for them. It's good for the practice. It's good for the practice owner.
Yeah, absolutely. I think that's great. And I think that some practices at least, have experienced a different level of challenge in that, recently. So I think that's really key for practices right now.
We're in an epidemic of trying to find really good people to not only get hired, but to stay in the practice. And so there's never more an important time than right now to really focus on what can we do internally in the practice to keep good people employed there.
Absolutely.
Yep, absolutely. Well, I believe we have another speaker joining us here, and I would like to bring him in and have him, Dr. Kwaya, have a chance to sort of introduce himself and a little bit about his topic. So I'm going to bring him in.
Yes, good afternoon, everybody. I am honored and privileged to be with you. It's afternoon here, and we are finished working this day. So the topic, my topic is about MSE. MSE is maxillary skeletal expander that is assisted by TADS, which is our mini screw. This mini screw implant help to open the sutures of the mid-face, not only the palate, but the whole mid-face, without pain, without any surgery, and will help to relieve the crowding of the teeth, but also it will help to help patients with sleep apnea to breathe better from their nose because it's increase the volume of the nasal cavity, not the nose that we have, the bone behind it. And it will also increase the volume of the palate by expanding the palate. And later on, we advance the midface forward. So expanding the palate, expanding the nasal cavity, advancing the whole midface, and then advancing the lower mandible, and then open the bite a little bit. And that's will help to correct all the problems of sleep apnea from entering the air from the nose until the end of the pharynx. And I will present many cases that show that is no limit for age to do this. Even we open the suture at age of 70 or 80 years old, there is no problem. And no procedure, surgical procedure involved in it. So it's all just by the light orthodontic pressure of 100 to 300 gram. I did more than 500 cases, and I will show you the progress. And with these 500 cases, I find that also we can relieve some temporary temporomandibular joint, the TMJ disorder, and also some oral facial pain, and at the end also help to resolve some neck pain. All this starting from help to breathe better, sleep better, and wake up without any headache. Of course, we are orthodontists. We do orthodontics, and we want to help everybody to have a beautiful smile, but also we want to help everybody to get good sleep and good breathing from his nose. So the technique will be explored during this conference from A to Z. And later on, if anybody is interested to have hands-on, then we'll do that later on. That is my topic.
Excellent. Thank you for introducing that and sharing it. I know it's a hot topic right now, and has been for some time, but airway is very important, and something that some people are from my experience attending courses and things like that. It's something that people are very interested in kind of learning how it impacts overall oral health and physical health of patients.
Right.
Yeah. Well, excellent. Well, I really think this is just a sampling of some of the great speakers that we're going to be having at the annual meeting this year in Greenville, South Carolina. The weather is supposed to be perfect that time of year. I think they said mid 70s,
Nice.
fall colors. So I'm very excited for that. I think it's going to be a fun experience as well as a great educational experience as well. So yeah, I'm really looking forward to that. We have 2 more live streams with speaker spotlights coming up. So 2 or 3, I can't remember exactly, but we'll be announcing those on Facebook where you'll be able to meet some of the other speakers as well. And of course, we will be sending you, if you've registered, we'll be sending you a link to the app So if you have questions for any of these great speakers, you can feel free to message them on the app and get some pre-event conversations going.
Nat, and I will rent a booth and the exhibition. Then anybody who has a question can come to the booth during the whole convention and ask whatever question relating to my lecture.
Great, excellent.
Wonderful.
Yeah. Any for any of you that are on, is there anything that you would like to share as far as maybe how people can get a hold of you or learn more about you? Maybe starting with Lois.
Sure. I have actually published a couple of books. And so if you want more information about what I do and what I offer, they can log on to ljbseminars.com. And that's also a way to connect with me directly. So that's the best way. I'm happy to have anybody pick my brain before the conference, during the conference, after the conference, free for the picking. So I'm excited to join you.
Excellent. How about you, Tia?
I also have a website called Rockstar Dental Assistant. You should be able to remember that, rockstardentalassistant.com. You can reach me through there. That is a book that I wrote, and I will be giving a few of those away at the conference. So, and again, pick my brain. Follow me on Facebook. I'm Tia Bloyd Hunter on Facebook. Follow me on Facebook, and I would love to start the conversations.
Yeah, excellent.
Also, I have a Facebook and YouTube channel, so everybody want to see some of my cases, live cases, how I do it. He can go to my Facebook and see them.
Excellent. So that is excellent. We're very excited to have you all joining us, and we think I'm very excited. It's going to be a great event. So thank you all for joining me tonight. Anything else anyone has to share? Anything you want to add?
Nothing for me. I'm just excited. I'll see you in October, folks.
All right.
Absolutely. Thank you.
Thank you. Thank you, everybody.